Welcome back to Insight. Dr. Chang has joined me. We're going to talk about the Parkview Post-Care Clinic. Did I say it right this time, or did I messed it up?
Post-COVID.
Post-COVID Clinic. See, I knew I would. I told you I would mess it up. I messed it up. But I get the idea, at least. There are so many long-term issues that obviously going into COVID, we didn't know that we were going to have to deal with. You know, we didn't really know anything. It's kind of been a learning curve. So let's talk about what are some of the long-term effects of COVID that you're starting to see now?
Mm-hmm. About 1 out of 3 people that diagnosed with COVID would have post-COVID or long-haul symptoms. Many of those symptoms are neurological. So we're talking about fatigue. We're talking about brain fog, confused in terms of taking care of day-to-day activities and work-related issues, headache, numbness, pain, loss of taste, lot of smell. So a lot of those symptoms are very devastating for our patients. And so the purpose of this clinic is to look into this and see what we can do to help.
So if I had COVID and I'm now experiencing some of those, I think brain fog especially, people think it's just, I'm just getting older, or it's because I didn't get a good night's sleep last night, or I'm just stressed out. It may not be those things. It legitimately could be from the COVID.
Correct. So I think that's a very important part because, as you mentioned earlier, we know very little about COVID. We still don't know much. But the key thing for us is to recognize those symptoms are possible. And also realizing that almost as no two people have exactly the same symptoms. So that's the first thing we do in the clinic is to listen to our patient, because patient's symptoms, concerns really are our symptoms and the concerns that we will prioritize to take care of.
So really nobody is the same. Everybody is unique, but
Right.
Are there some specific demographics that seem to be getting hit harder than others?
Yeah, that's such a great question. Pretty much every demographics classification you can think of. In terms of the severity of COVID, you can have people admitted into hospital and stay in the ICU with a ventilator, or you can have people with no symptoms or minimal symptoms. But both, and oftentimes even people with mild symptoms, may develop worse post-COVID symptoms. And gender-wise, female has a bit more possibility of getting it. Age-wise, doesn't matter, young, old. Ethnicity, it's so democratic, it covers every. So it's very broad in terms of coverage.
It has been very interesting, I think, as we've watched throughout the pandemic, that it doesn't seem to matter. Somebody you know that has always been very healthy and you would have thought probably won't even get COVID, has gotten it and it's been so severe.
Yep.
And then somebody else that you thought, they've got kind of a compromised immune system, I'd be fearful if they get it. They get it and totally mild. Or maybe don't get it at all after they were exposed to it.
Yeah, so little we know.
Yeah, it's so different. Well, I want to talk more about the long-term COVID clinic at Parkview, when we should go there, what we should do, the logistics of all of it. We'll talk more specifically about the clinic when we come back. Stick with us.